With us in the studio is medical doctor TVC Bawondu. Thank you for joining us. Now, Nigeria still ranks highest when it comes to maternal mortality. What are we not doing right?
Yeah, thank you. We're not doing quite a lot of things right. If you look at the trajectory of the problems concerning our maternal child health, it's sad that as at now, as much as out of the 800 women dying daily, minimum of 160 are Nigerian. So it's sad. Now, if you look at the factors causing the maternal death, of course, you have bleeding, hemorrhage commonly. You have infections, both malaria, HIV, and other postpartum infection. We also have hypertension in pregnancy causing those death. But beyond these factors you are saying, there are underground, or what we call those underground factors that are driving.
Are these symptoms not treatable? Can they be handled in Nigerian hospitals?
Again, they can be handled, but again, what are those things driving these factors? Okay, what are the social, cultural, religious, and economic factors driving those things? Now, why should we at this time also be adding number of deaths? You know, women that are trying to have child. And then look at it, as long as women are dying, children will be dying, and then they will be challenged at the level of household.
All right, so how do we bring all of this together and move forward? Because this ranking is not good for our country.
We need to look at the cross-cutting issues. There are social, cultural issues. Look at, for instance, women literacy. Look at how that fits into the whole maternal death. Once a woman is illiterate, the choice is limited, ability to get money is limited, education is challenged. In that case, you see that these are the factors, you know, the power play in the house, the main dynamics that determine what happens in the household, the level of malnutrition in Nigeria, for instance, is going to feed into maternal death, and it's going to feed into child death. So all these factors put together, the level of poverty, if Nigeria is the poverty capital of the world, then
all right, quickly, because we need to wrap up. Your final words, especially to the government, because all of this still boils down to the government driving all of these issues.
Again, it's not just government. Yes, government needs to drive it, but again, we need to go as local as possible, create access to these women, research further into the social, cultural issues affecting maternal and child health.
Now, we have talked about the issue of some other factors that compound the issue of mortality in Nigeria. What is the place of family planning?
Again, very important. You find out that right now, what we get is that there is less than 20% of women that have access to family planning. If you don't space child, if you don't have means of saying, I have to delay the space between one child and the other, then you have a problem. And you know there are cultural issues concerning family planning. You know that the church does not want it. Even the family don't want it. There are a lot of rumors concerning it. We're not communicating this thing appropriately. We need to step up communicating health. We need to look at those places that is driving the negative maternal health indices in the country.
What would you say is the impact of all the funding coming into Nigeria and even efforts by the government to reduce the mortality rate?
Far and in between, those are just pure window dressings, if I may say, because the core of those maternal challenges are in the rural areas, and government spaces are not there. The fundings are not getting there, and human resources are not being moved to those areas. The cultural issues and religious issues and gender issues that is driving negative maternal health are not being addressed appropriately and robustly. So again, as we go on, we see that we keep adding numbers to this maternal and child health because the figure has remained barely the same since the past 15 years.
What's the way forward now? From this standpoint where we are, how do we go about avoiding this or reducing this?
A lot of things feed into this maternal and child health death. You cannot have this number of malnourished people in the country. You cannot have this number of very poor people in the country. You cannot have this number of people that are not coming to the hospital or being attended to by skilled worker, then drive here. Then what other thing we need to do that we need to incentivize good behavior in terms of delivery. What I mean is that we have to create a kind of conditional cash transfer that will make somebody deliver in the hospital, embrace family planning, and space children. These are a mix of issues that you can really do, and then do your monitoring and evaluation. Don't and behold, you get there.
Thank you very much, Dr. TVC Bawondu.
It's my pleasure always, yes.
Thank you. Right. Now, access to cleaner and healthier means of cooking remains a big challenge for a large number of Nigerian women, especially those living in rural areas.